Welcome. Uh, we are talking about, we are discussing non-communicable diseases. So we defined non-communicable diseases as the group of disorders, those that do not communicate, those that cannot be shared to another person, from one person to the other. Different from communicable diseases, those that can be shared from one person to the other. So amongst those are conditions that have that include hypertension. So we shall be talking about hypertension, we shall be talking about diabetes, we shall be talking about obesity, and a lot other lifestyle disorders that fall under the non-communicable diseases. So to start, we are discussing hypertension. So hypertension is just a word that is loosely used, or that is also applied to what is known as high blood pressure. Okay, occurs when your blood pressure increases to unhealthy levels, which means there are some levels in which it is supposed to be moving. Okay, blood pressure simply talks about the pressure in which blood is supposed to move in the blood vessels. Narrow arteries increase blood flow because they increase resistance. So the narrower the artery, the higher the pressure. Just as you can see, like as you can try when maybe you're watering using a hose pipe, when you narrow the lumen of the artery, the pressure goes a bit higher. So the same happens in the blood streams. Once the arteries get the lumen of the artery reduced due to other factors, or a lot of other factors, blood pressure increases. Okay, therefore it is very common. In fact, it affects about 75 million people in American setups. And you know, we don't just have good recordings, good numbers. You will find that actually maybe here it's even much more had we been recording these things. Hypertension may develop over the course of several years. During those years, you may not notice any symptoms. Even without symptoms, high blood pressure can cause damage to the arteries and the blood vessels. Early detection is important. Therefore, a person is advised to regularly check the doctors and regularly do checkups. You know, this time around, there are blood pressure machines almost everywhere in pharmacies and everywhere you go. It is important to have this habit of checking your blood pressure. Treatment for hypertension includes both prescription as well as health style, healthy lifestyle changes. If the condition isn't treated, it could lead to health issues, which include heart attack or even a stroke, which are very debilitating conditions. Hypertension is generally a silent condition, and many people will not experience any symptoms. It may take years or even decades for the condition to reach the levels where enough to reach the level severe enough that symptoms may become obvious. Some of the symptoms that are observed in hypertension include headaches, shortness of breath, nosebleeds, flushing, dizziness, chest pain, visual changes, as well as blood in urine. These symptoms don't occur in everyone with hypertension, but waiting for the symptoms to occur may be very fatal. The best way to know if you have hypertension is regular checkups. Check every time you have access to the machine, check, and at least three or more diagnoses of the same high numbers of hypertension would suggest the diagnosis. So if you go today and find that your BP is high, the following day again, just like that, at least on 3 consecutive times, you find that your hypertension, your BP levels have been high, then you can safely suspect that you have hypertension, and now go to the medical personnel for proper evaluation and for proper advice on how you can adjust to these conditions. Is it that you are supposed to go for medication, or lifestyle arrangement would be enough? So the medical personnel will be able to give that further advice. For example, if you have a family history of heart disease, or have risk factors for developing the condition, you may need to have your regular check, your blood pressure checked at least twice a year. So regular checkups, and if you know that in the family there is this history, at least have these checkups, serious regular blood pressure checkups, at least twice in a year, so that you catch it early. You've seen from where I've started, if you allow the conditions to the presentation to continue, it may be fatal. So you don't need to allow it to go for a long time. There are two types of hypertension. Each type has a different cause. Number one, primary hypertension, so-called essential hypertension. This kind of hypertension develops over time with no identifiable cause. Researchers are still unclear to what mechanisms cause such kind of blood pressure to come up, why it increases slowly, and the combination of factors uh, have been pointed at as being the causes to this. Number one, the genes. Okay, it is running in genes. They don't know why it is happening, but they just find that gradually this person has been having high blood pressure slowly developing. When they check, they find that it is actually running in the family. Physical changes. If something in your body malfunctions, you may begin experiencing issues throughout your body. So this could be due to some physical changes or some malfunction in the body. Then blood pressure can arise. Okay. High blood pressure may also be one of those issues that can be that can cause these issues, including environmental factors. Okay, environmental factors, overtime unhealthy lifestyle choices, lack of activity, and poor diet have a toll on our body and can bring about issues like hypertension. So the hypertension that just starts on its own is gradually rising, causing that to be classified as primary hypertension, whereby this other one, which is in which high blood pressure is due to another malfunction somewhere, would be secondary. So it would be secondary maybe to a kidney disease. Kidneys work hand in hand with the heart. Okay, so if the kidneys have a problem, the heart will also show that will also malfunction. So once you correct the kidney problem, then the heart will, then the problem also in hypertension will also be normalized. Being overweight or obese can increase the risks of hypertension, and therefore it is important to check your weight and be within the normal levels. Or it can be due to secondary conditions. Primarily, these ones that arise without any identifiable cause, which could be those lifestyle choices. You find this person has poor lifestyle choices, no activity, then slowly their BP keeps on rising, rising, rising. The time they realize it is already up to the levels where it is difficult to control. But if you are doing regular checkups, you find it early, you catch it early, you can just do amendments on your lifestyle and have everything corrected. Several conditions may cause secondary hypertension. These include kidney disease. If the kidney gets affected, and the hypertension can also arise. And there are a number of those conditions, including side effects of some medications, use of illegal drugs, alcohol abuse, as well as certain endocrine tumors may actually cause hypertension secondary to those. So treatment there starts by treating the primary cause, which is if it is if it is a disorder of the endocrine tumors, treat the tumor, then the hypertension will go. Okay. Diagnosing hypertension is as simple as taking blood pressure readings. Most doctors' offices check. Usually when you go to the hospital, anywhere where you have contact with the medical personnel, you actually have you have your your BP checked. Okay, if your blood pressure is elevated, your doctor may request you have more readings over a course of a few days or weeks. Hypertension diagnosis is rarely given just after one reading. So take readings at least 2 to 3 days, consecutive days, you find that it has been high, then you should query and actually suspect that you may have been developing hypertension. If your blood pressure remains high, your doctor will likely conduct more tests to confirm. You go back maybe after a week of checking every day, there you'll be told maybe to be going to the nearest pharmacy almost every day, check your BP, and take the readings after a week. If they found that they have been high throughout, further tests can be instituted, which will include urine tests, cholesterol screening, and all these. These tests can help your doctor identify any secondary issues causing your blood pressure. So if it is any secondary cause that is bringing about your blood pressure, then the attention goes to that cause, treat it, then the blood pressure will actually normally be get back to normal. So BP readings are seen by two numbers. The upper number is known as the systolic, while the lower number is known as the diastolic blood pressure. So systolic number indicates the pressure in your arteries when your heart beats and pumps out blood. Diastolic pressure, which is the number under, is the reading of the blood pressure in your arteries between the beats of the heart. So the four categories define blood pressure reading for adults. A healthy blood pressure reading is somewhere around 120 millimeters of mercury over 80 millimeters of mercury. So that is within normal. And it's not that every time every person is supposed to have this. It goes with activity and age, with a lot of other factors. So the readings of somewhere around 120 millimeters of mercury to okay, readings of 120 millimeters of mercury to 139 millimeters of mercury, or the historic number is between 80 to 90. Okay, let me come again on this one. On the healthy readings, we have 120 millimeters of mercury to 80 millimeters of mercury. Pre-hypertension, the systolic number is between 120 millimeters of mercury and 130 millimeters of 139 millimeters of mercury. Or the diastolic number is between 80 to 89 millimeters of mercury. This doctor may not need to treat pre-hypertension with medication. Instead, the doctor may encourage lifestyle changes to help lower the numbers. Okay, so this is where we needed to adjust a bit. Okay, this is where we needed to adjust. So healthy readings range from 120 millimeters of mercury. I just forgot to adjust it in time, but you can follow it from here. From 120 millimeters of mercury to 130 millimeters of mercury, it is within normal. Okay, that is within normal. Then pre-hypertension will start from somewhere around 130 millimeters of mercury to 139 millimeters of mercury. That is what is going to show that it is actually getting into hypertension. So that is pre-hypertension. So you find your readings every time within 130 something, before 140, then you know that it is within the pre-hypertension order. Okay, so in this category of pre-hypertension, you may not need to take medication. So that is why regular checkups are very important, so that you can track it while it is still at pre-hypertension. Because once you find it at pre-hypertension, it is easy for you to just analyze your lifestyle and actually work on it. Then that is going to correct the situation. Once you allow it to continue, it will go to stage 1 hypertension, where the systolic number is between 140 millimeters of mercury to 159 millimeters of mercury. Okay, or the diastolic number is between 90 to 99. Stage 2 hypertension, this stage of hypertension is severe and dangerous. Its systolic number is over 160 millimeters of mercury, or diastolic number of 100 millimeters of mercury and above. So this is an advanced stage of hypertension and very dangerous. A blood pressure reading is taken with a pressure cuff, and all those readings are gotten. So these are some of the readings that you're supposed to take care of. Once you find the hypertension going above 140, then you know that it is getting to unhealthy levels. Treatment options of high blood pressure, a number of factors help the doctors determine the best treatment options. So for primary hypertension, if the doctor diagnoses you with primary hypertension, lifestyle changes may help reduce the blood pressure. Okay, if lifestyle changes alone ain't enough, then they stop being effective. The doctor may prescribe some medication. Secondary hypertension, the key is to treat what has been causing that. Okay, so if the problem has been due to the underlying issue because of the problem has been due to kidney disease, the issue is to cure the kidney disease. Once it is cured, then the blood pressure will actually get back to normal. Okay, medications of high blood pressure include beta blockers. These reduce the amount of blood pumped through the arteries. Okay, it makes your heart beat slower with less force. That is what the beta blockers do. Diuretics, which are high sodium levels and excess fluid in the body, can increase blood pressure. Therefore, diuretics, also called water pills, help kidneys remove excess sodium from the body. As the sodium leaves, the amount of blood fluid in the body decreases, which helps lower blood pressure. There are also SCE inhibitors, which prevent the body from producing as much of the SCE chemicals and helps blood vessels relax and reduce blood pressure. Angiotensin 2 receptors, calcium channel blockers, as well as alpha 2 antagonists, which help to relax the muscles, which reduce blood pressure. So all these are just drugs that type of drugs that can be given to reduce hypertension, and it's just important that we have an idea of about them. Home remedies for hypertension, lifestyle changes can help to control factors that are causing hypertension, and as well as home remedies, which include developing a healthy diet so that you control the hypertension levels. The complications, if not controlled in good time, may include heart disease, stroke, as well as heart attack, which are very bad. Some of the dietary adjustments that we can make is to include more of the fruits, the vegetables, the whole grain, and all this, including introduction of activity. You aim to get at least 150 minutes of moderate physical activity each week. That's about 30 minutes, 5 times per week, if you decide to put it 5 times per week. If you want, you can put it in 3 times per week, which is 50 minutes, 3 times a week, or in whichever way that you want to put it, but at least 150 minutes per week. Reaching a healthy weight is also important. If you have seen that your BMI is showing you that your weight is too much, you can start working on it and make sure that you get back to the normal weight. Other activities which can also be helpful include deep breathing, relaxation, meditation, and others, including the reduction of alcohol intake, as alcohol can raise blood pressure. Quitting tobacco smoking is also very important, as tobacco hardens the blood vessels, which will actually predispose you to developing hypertension. Okay, so there are a lot of home or health style changes that you can make. Eat less meat and more plants, reduce sodium, cut sugar, and others. So there's this blood pressure now which comes about in pregnancy. Let's look at it. Women with hypertension can deliver healthy babies despite having the condition, but it can be dangerous to both mother and baby if it is not monitored and treated in pregnancy. Women with blood pressure are more likely to develop complications. For example, pregnant women with hypertension may experience decreased kidney function. So there is this type of hypertension which just comes about when you're pregnant. When somebody is pregnant, comes about, immediately they deliver, it goes. Okay. Some women may develop hypertension during their pregnancies. This condition is called gestational hypertension. It often reverses itself once the baby is born. So developing hypertension during pregnancy may increase the risk of developing hypertension later in life. So once that starts happening, it may bring about future hypertension diagnosis, which may be lifelong. Okay, preeclampsia, in some cases, pregnant women with hypertension may develop preeclampsia, which is hypertension in pregnancy coupled with proteinuria, protein, which means protein in urine during pregnancy. That is the difference with the other gestational hypertension. So gestational hypertension was just hypertension in pregnancy, okay? High blood pressure in pregnancy, which will reverse after birth. But this other kind of high blood pressure known as preeclampsia is high blood pressure coupled with protein in urine. This condition increases blood pressure and causes kidney problems that result in increased protein levels in in urine. As this condition worsens, the risks increase for mother and baby. Therefore, preeclampsia can lead to eclampsia, which is occurrence of convulsions not attributable to any cerebral conditions, which causes seizures. So the mother can go into eclampsia, and this is the second leading cause of maternal death, as is in the United States. Complications for the baby include low birth weight, early birth, stillbirth, if it goes to that extent. There is no way to prevent preeclampsia. The only way to treat these conditions is to deliver the baby. If you develop this condition during your pregnancy, your doctor will closely monitor your complications, and the solution will be to deliver the baby. Once the baby is delivered, then everything reverses. Effects of hypertension in the body. It is very bad. It has very negative complications on the body, and it can cause damage to the arteries and make the healthy arteries are flexible and strong, but this can cause damage to the arteries, cause some obstruction, and cause them to be less to be inelastic, as well as damage the heart, okay, cause heart attack, arrhythmia, and sudden cardiac death. It can cause brain damage, which may also result in conditions such as developing a stroke. So tips for preventing hypertension, as have already been discussed, lifestyle as well as treatment. If actually you have to continue staying healthy. Physiotherapy also does a very good job as as they promote activity, usually preventive or curative, as an adjunct treatment to the regime, where you embrace activity, aerobic exercises. There are a lot of aerobic exercises or aerobic groups being done in every corner of town nowadays. So it is important that a person is active or enrolls in one of these groups that are doing aerobics. So this is one of the conditions that we are looking at, which is hypertension, and it is known as a non-communicable disease, because as you have seen from the discussion, it is not contagious. It cannot be moved from one person to the other, and hence that qualifies it to be a non-communicable disease. Thank you so much for listening.